Section 9. 1. What is the name for the condition in which all of the body's systems are working at their best? A. Homeostasis. B. Hormones. C. Glands. D. Digestion. The answer is A. 2. The body is divided into blank systems. A. 7. B. 9. C. 10. D. 11. The answer is C. 3. Body systems are made up of A. Cells. B. Glands. C. Tissues. D. Organs. The answer is D. 4. What are the building block of our bodies? A. Organs. B. Cells. C. Tissues. D. Glands. The answer is B. 5. Posterior or dorsal means A. Away from the body. B. The back of the body or body part. C. The front of the body or body part. D. Closer to the torso. The answer is B. 6. The largest organ and system in the body is the A. Skin. B. Endocrine. C. Reproductive. D. Musculoskeletal. The answer is A. 7. Normal changes of aging include which of the following? A. Skin is less elastic. B. Nails are harder and more brittle. C. Hair thins and may turn gray. D. All of the above. The answer is D. 8. Which of the following is not a part of the skin? A. Epidermis. B. Dermis. C. Epicardium. D. Subcutaneous. The answer is C. 9. How many bones are there in the human body? A. 206. B. 210. C. 220. D. 212. The answer is A. 10. The point at where two bones meet is called A. Tissue. B. Contract. C. Glands. D. Joint. The answer is D. 11. Blank provide movement of body parts to maintain posture and to produce heat. A. Joint. B. Muscles. C. Cells. D. Organs. The answer is B. 12. Which of the following is not included in normal changes of aging? A. Bone loss density. B. Muscles weaken and lose tone. C. Height is gradually lost. D. Grows 6 inches taller. The answer is D. 13. Which of the following is the two main parts of the nervous system? A. Central nervous system, CNS. B. Peripheral nervous system. C. A and B. D. None of the above. The answer is C. 14. The three main sections of the brain are A. Cerebrum. B. Brainstem. C. Cerebellum. D. All of the above. The answer is D. 15. The outer part of the eye is called A. Sclera. B. Retina. C. Iris. D. Cornea. The answer is A. 16. Earwax and hair in the ear protect the ear from A. Light. B. Foreign objects. C. Water. D. None of the above. The answer is B. 17. The heart is an A. Bone. B. Organ. C. Muscle. D. Artery. The answer is C. 18. The contracting phase of the heart is the A. Expiration. B. Diastole. C. Systole. D. Inspiration. The answer is C. 19. The resting phase of the heart is the A. Diastole. B. Respiration. C. Inspiration. D. Expiration. The answer is A. 20. Normal changes of aging include which of the following? A. Voice weakens. B. Lung capacity decreases. C. Lung strength decreases. D. All of the above. The answer is D. 21. Blank is a process of expelling solid waste made up of the waste products of food that are not absorbed into cells. A. Digestion. B. Ingestion. C. Absorption. D. Elimination. The answer is D. 22. Fecal anal incontinence is the A. Inability to control the bowels. B. Inability to control urine. C. Inability to control drooling. D. Inability to control bleeding. The answer is A. 23. The reproductive system allows human beings to blank. A. Multiply. B. Separate. C. Reproduce. D. None of the above. The answer is C. 24. Blank protects against a particular disease that is invading the body at a given time. A. Acquired immunity. B. Specific immunity. C. Nonspecific immunity. D. Invading immunity. The answer is B. 25. What is the name of the clear yellowish fluid that carries disease-fighting cells called lymphocytes? A. Sperm. B. Lymph. C. Gonads. D. None of the above. The answer is B. Section 10. 1. Blank means helping residents into positions that will be comfortable and healthy for them. A. Positioning. B. Homeostasis. C. Holistic. The answer is A. 2. In the blank position, the resident lies flat on his back. A. Lateral. B. Prone. C. Supine. The answer is C. 3. A person in the blank position is lying on his or her back. A. Prone. B. Lateral. C. Supine. The answer is B. 4. A person lying in the blank position is lying on his or her stomach. A. Prone. B. Sims. C. Fowlers. The answer is A. 5. A person lying in the blank position is partially reclined. A. Prone. B. Sims. C. Fowlers. The answer is C. 6. A draw sheet is an extra sheet placed on top of the bottom sheet. A. True. B. False. The answer is true. 7. Blank is rubbing or friction that results from the skin moving one way and the bone underneath it remaining fixed or moving in the opposite direction. A. Shearing. B. Bearing. C. Shaving. The answer is A. 8. Moving a resident as a unit without disturbing alignment of the body is A. Block rolling. B. Wood rolling. C. Log rolling. The answer is C. 9. To blank means to sit up with the feet over the side of the bed for a moment to regain balance. A. Swing. B. Dangle. C. Shake. The answer is B. 10. The science of designing equipment and work tasks to suit the worker's abilities. A. Transfer board. B. Ergonomics. C. Gait belt. The answer is B. 11. A blank is a safety device used to transfer residents who are weak, unsteady, or uncoordinated. A. Transfer belt. B. Gait belt. C. Safety belt. The answer is A. 12. Where should the gait belt be placed? A. Around both legs of the residents. B. Around the waist of resident over clothing. C. On the wheelchair. The answer is B. 13. What is the name of the equipment that can help transfer residents? A. Back belt. B. Holding belt. C. Gait belt. The answer is C. 14. A stretcher is another word for A. Cane. B. Gurney. C. Crutch. The answer is B. 15. Which of the following equipment prevents wear and tear on your body? A. Stretcher. B. Mechanical or hydraulic lift. C. Sling. The answer is B. 16. Which of the following statements are not true about a mechanical lift? A. You and the resident would not get hurt if you use the lift improperly. B. You must be trained on the specific lift you will be using. C. Lifts help prevent injury to you and the resident. The answer is A. 17. Which of the following statements are true about transferring a resident onto and off a toilet? A. Position wheelchair at a right angle to toilet. B. Ask resident to push against the armrest of the wheelchair and stand. C. All of the above. The answer is C. 18. What is another word for walking? A. Ambulation. B. Pacing. C. Moving. The answer is A. 19. A resident who is ambulatory is A. One who can move in bed. B. One who can get out of bed and walk. C. None of the above. The answer is B. 20. The purpose of a cane is to A. Help with balance. B. Help visually impaired resident. C. None of the above. The answer is A. 21. The blank cane is a straight cane with a curved handle at the top. A. C cane. B. Quad cane. C. Functional grip cane. The answer is A. 22. This type of cane has a grip handle rather than a curved handle. A. C cane. B. Quad cane. C. Functional grip cane. The answer is C. 23. Which cane is designed to bear more weight than the other canes? A. C cane. B. Quad cane. C. Functional grip cane. The answer is B. 24. What equipment can be used when the resident can bear some weight on the legs? A. Walker. B. Cane. C. Crutches. The answer is A. 25. Residents who can bear no weight or limited weight on the leg use A. Walker. B. Cane. C. Crutches. The answer is C. Section 11. Fill in the blanks. Wants, them. Time, condition. Consciousness, confused. Introduce, position. Friendly. Formal. Resident. Arrives. Bed, tidy. Admission kit. Welcome, wanted. Tour. Valuables. 1. Prepare the room before the resident blank. The answer is arrives. 2. Make sure the blank is made and the room is blank. The answer is bed, tidy. 3. A blank blank is usually in the patient room before he/she is admitted. The answer is admission kit. 4. When a new resident arrives at the facility, note the blank and blank. The answer is time, condition. 5. Observe the new resident for level of blank and if he/she seems blank. The answer is consciousness, confused. 6. Blank yourself and state your blank. The answer is introduce, position. 7. Smile and be blank. The answer is friendly. 8. Always call the person by his, her, blank name until they tell you what they want to be called. The answer is formal. 9. Never rush the new blank. The answer is resident. 10. Make sure the new resident feels blank and blank. The answer is welcome, wanted. 11. Offer to take the resident on a blank. The answer is tour. 12. Ask the new resident if he/she brought any blank. The answer is valuables. 13. Place personal items where the resident blank blank. The answer is wants, them. True and false. 14. Providing fresh water is something you should do every time you leave a resident's room. The answer is true. 15. Report any changes in resident's weight to the nurse. The answer is true. 16. Residents do not have the right to receive advance notice of any room or roommate change. The answer is false. 17. Sphygmomanometer is used to measure blood pressure. The answer is true. 18. Alcohol wipes cannot be used for infection and minor wound care. The answer is false. 19. Otoscope is an instrument used to examine the eye. The answer is false. 20. The dorsal recumbent position is used to examine the chest, breasts, and abdomen. The answer is true. 21. Lithotomy position is used to examine the rectum. The answer is false. 22. To determine height on a standing scale, gently lower the measuring rod until it rests flat on the resident's head. The answer is true. 23. Admission kit will contain a urine specimen cup, personal care items, drinking glass, toothpaste, and soap. The answer is true. 24. Residents should not be told of their rights until after admission. The answer is false. 25. The room should be prepared when the new resident arrives. The answer is false. Section 12. True and false. 1. Illness and disability cause great stress. The answer is true. 2. Common noises in facilities can upset and irritate residents. The answer is true. 3. Caffeinated drinks such as coffee or some teas do not prevent sleep, fatigue, and irritability. The answer is false. 4. A resident room is not his or her home and should not be treated with respect. The answer is false. 5. Providing a clean, safe, and orderly environment is an essential part of your job. The answer is true. 6. Normally beds are kept at their highest horizontal position. The answer is false. 7. The water pitcher and cup are kept in the bedside stand drawer. The answer is false. 8. It is important to always place the call light within the resident's reach. The answer is true. 9. Curtains and screens block sounds from the other rooms. The answer is false. 10. You do not have to wear gloves when rinsing bedpans and urinals. The answer is false. 11. Sleep is a natural period of rest for the mind and body. The answer is true. 12. The circadian rhythm is 24-hour day-night cycle. The answer is true. 13. Insomnia is the lack of ability to fall asleep or stay asleep. The answer is true. 14. Sheets that are damp, wrinkled, or bunched up under a resident is not uncomfortable. The answer is false. 15. Hold soiled linen close to your body and place it in the proper container immediately. The answer is false. 16. An occupied bed is a bed made while the resident is not in it. The answer is false. 17. It is easier to make a bed when the resident is in it. The answer is false. 18. Hospital corners help keep the flat sheet smooth under the resident. The answer is true. 19. A close bed is a bed completely made with the bedspread and blankets in place. The answer is true. 20. A surgical bed is made to accept residents who are returning to bed on stretchers or gurney. The answer is true. 21. Good lighting is not important to residents. The answer is false. 22. Always knock and wait to receive permission before entering. The answer is true. 23. If residents seem sad, anxious, or fearful, just ignore them. The answer is false. 24. You do not have to keep a resident room neat and clean. The answer is false. 25. An emesis basin is a kidney-shaped basin often used when giving mouth care. The answer is true.